मैडम हम लेक्चर स्टार्ट कर दीजिए।
Bismillahirrahmanirrahim. This is Dr. Amna Khurshid from Histopathology department, and today we are starting gastrointestinal module. This gastrointestinal module starts from the oral cavity, and then that will be covering the tubular part of the gastrointestinal tract, that is esophagus, small intestine, colon, and then definitely it's not going to end up with the tubular part. Then like liver and pancreas need to be covered because that is a part of digestion and help in the digestive tract. And once these organs are disordered, so it's not possible to complete the function of digestion. So this module is basically taken by myself, Amna Khurshid, and by Dr. Asad Jafri. Initially, the oral part will be taken by me, and then Dr. Asad will take few lectures about the tubular part, that is esophagus, stomach, etc. And then again, liver and pancreas will be taken by me. So now today we are starting with the oral cavity, but this oral cavity, as we are following usually Robbins, which is the textbook recommended. So this oral pathology part in Robbins is covered in the chapter of head and neck. So once we try to find out this the topics, the relevant figures that are in Robbins, they are provided in head and neck part. And one thing I again want to emphasize, that although we cannot emphasize that this is the only book which should be done, but you at least, what is important is that you have to go through the gross and photomicrographs which are given in Robbins, because once you are going to give exam, the OSPE session in JP this SMC, basically the figures of OSPE are taken largely from Robbins. So even if you are not doing text from Robbins, at least I would recommend at the start of the module that you should be doing the gross photographs and the pictures which are given in Robbins. At least that part should be covered. And in my lecture, basically all the material, including the pictures and the gross photographs of the lesion, are taken from Robbins. So if you are not going to that, at least from the PowerPoints, take those pictures, and the OSPs are usually from those pictures in JSLU. So today we are starting with oral cavity. Why oral cavity is important? Because the oral cavity is a place where you can have systemic and the local manifestations of various diseases. Although mostly the diseases of the oral cavity are not very harmful and they are self-limited, but they need to be known, because even some of these lesions like candidiasis, every one of us heard of candidiasis, that even that candidiasis comes in the differential diagnosis of malignant lesions. So it is very important to know the manifestations of even the different systemic and local diseases in oral cavity. So, and then what is important, that if you ask me what are the three most important topics which need to be covered from the oral cavity, the one is the candidiasis, the other is herpes, and then there are some irritative lesions which present as pseudotumors. So what pseudotumors are? Pseudotumors are those which are not actually the tumor, but they look like tumors. So if on the you can see over here, on the top left, first picture is that of the candidiasis. Like many of you have heard of that, there is a white patch in the oral cavity. Now there are three different differentials of the white patch, and one is that of the oral cavity. And if I locate it, you can see there is a white membrane in the oral cavity. Then again, this is candidiasis. But now what is different, which we'll be doing in detail in lecture, is again this is candidiasis, but here there is a mixture of redness and the white patch. Although in the morning you don't want to hear about it, but the diseases which are common like candidiasis, herpes, you need to know everything. Now this lesion, the third picture, you can see that this is tongue, and on the tongue there is Again, a white patch. If you look at the patient clinically, it again appears as white patch, but this condition is called hairy leukoplakia. At your level of third year, we don't expect that you should be identifying hairy leukoplakia, but just to emphasize that this lesion is so characteristic that if somebody has this lesion, and it is recommended that those must be work out for the lesions like AIDS, for the diseases like AIDS. Then this is herpes, where it has presented as ulceration. Aphthous ulcers, we will be doing these diseases in detail, but just to give you an overview that what are the different diseases we are going to be covered. And again, I'm just telling you, the lesions are, most of the lesions are self-limiting, but as they are so common that we need to emphasize and we need to know them in detail. So this is aphthous ulcer, this is Kaposi sarcoma, a malignant condition. You can see that this is a red raised area. We are going to do it in the differential diagnosis of a very common lesion which is called pyogenic granuloma. Again, this Kaposi sarcoma, if somebody of you have heard from, this is used to develop in patients of AIDS. Then these are the gingival lesions. What is gingiva? This is the gum area, and again a pretty common condition of again a very pretty common condition which is due to the bad oral hygiene, and then there are some other disorders as well, the necrotizing ulcerative periodontitis. Again, secondary to develop, secondary to clot, and when we say periodontitis, it means the connective tissue and the ligaments are affected. So just an overview that how simply the oral cavity is a gateway to so many of the diseases. So starting from here, the first, which is the inflammatory slash reactive and tumor-like lesions. Okay, so when we say tumor-like lesions, it means the pseudotumors. Pseudotumors means that clinically they may mimic with tumor. When you are doing neoplasia, we have seen that where this word actually the neoplasia or tumor comes whenever there is a swelling of any area. So, okay, the tumor is just the swelling of any area. So these are called pseudotumor because they present these lesions, that inflammatory reactive tumor-like lesions, that they present as swellings, but they are actually not tumors, which we come to know by looking at their morphology. But clinically, the clinicians or the patient himself can be suspicious that I'm going to have one of the tumors. So there are 2 to 3 types. Out of these, the most common is pyogenic granuloma, and we'll be doing all details of pyogenic granuloma and the names of basic inflammatory or reactive conditions. As I have already told that in JSMU, the OSPI, the figures are basically from Robbins, and once they have given OSPI of this pyogenic granuloma with all the detailed its consequences. So this is one of the lesions which I will discuss in detail, and which is out of these 3-4 lesions, this is most common. And then we'll be doing other lesions as well. So when we say in the inflammatory slash reactive tumor-like lesions, one is the fibrous proliferative lesion, is irritation fibroma. This is primarily located in the buccal mucosa along the bite line. When we say fibrous, where does this fibrous tissue comes? This is not epithelium, like epithelium of the oral cavity is squamous, but this fibrous term comes from the one of the components which make up connective tissue. The connective tissue is made up of what? The blood vessels, the lymphatics, the fat, and the fibrous tissue. So basically, in inflammatory reactive tumor-like lesions, there is abrupt, exuberant proliferation of the fibrous tissue. So if we look at it under the microscope, how does it appear? It is composed of nodular mass of fibrous tissue with inflammatory cells and covered by squamous mucosa. And why it will be covered by squamous mucosa? Because the normal epithelium over here is squamous mucosa. So in inflammatory reactive conditions, first is the irritation fibroma. This is the clinical view of the irritation fibroma. If without history, you look at over here, if the patient is a patient would have been concerned about the lesion, because you can see that this is the normal mucosa of the oral cavity, which is of lined by squamous epithelium, and this is a raised area. This you can call it nodule. If you have to describe the lesion, you will be saying that this is oral cavity as it is identified by the teeth, and then there is a raised area. You can call it nodule or papule, which is covered by this light pink area. So without knowing the history and without knowing the exact nature, somebody can think of it that this is a tumor. This may be like in oral cavity. If I ask someone, okay, what would be the most common, what would be the most common lesion? क्या कौन सी लीजन है जो आपको सबसे ज्यादा पता होगी, तो you will think of squamous cell carcinoma. लेकिन जब हम squamous cell carcinoma देखेंगे तो we'll come to know that is very different. But for a layman, this may be something which is concerning. That is why these are called pseudo-tumor lesions or tumor-like lesions. But they are not actually tumor, but they can look like tumor. So first is the irritation fibroma, and this is the clinical view of the irritation fibroma. Moving to the next inflammatory or pseudo-tumor lesion is pyogenic granuloma. Among the pseudo-tumor lesions, this pyogenic granuloma is the most common. It is inflammatory lesion. As I know that many of you are following other books like except Robbins, like for the books which are there for the steps and some. So in those you can find this lesion pyogenic granuloma as a type of hemangioma. ठीक है, रॉबिन्स में क्योंकि हम बेसिकली रॉबिन्स की टेक्स्ट पेपर को फॉलो करते हैं, इसलिए हम इसको इन्फ्लेमेटरी कंडीशन या सूडो रिएक्टिव कंडीशन या सूडो ट्यूमर कह रहे हैं. बट अगर आप कोई और किताब फॉलो करें, वास्तव में स्टेप्स की कुछ बुक्स हैं, तो उसमें दे हैव टेकन इट एज type of hemangioma. And even in some of our textbooks like surgical pathology, they are given in the condition like they are given under the heading of hemangioma. But what is important is that this is not a malignant condition. और एक चीज और याद रखें यहाँ पे कि ऐसा भी नहीं है कि ये अगर pyogenic granuloma is there for long, it will convert into a malignant or into a carcinoma. Okay, this is what I'm telling you, because sometimes what is being asked is that what is the ultimate fate of pyogenic granuloma. So don't, either you take it pseudo tumor or you take it as a type of hemangioma. It is not going to convert into squamous cell carcinoma, because sometimes when this question is being asked, you reflexly answer, or students reflexly answer is it will convert into squamous cell carcinoma. No, it cannot be converted into squamous cell carcinoma. And why it cannot be converted into squamous cell carcinoma? Because the cell of origin of pyogenic granuloma is something from the mesenchymal tissue, something from the connective tissue like blood vessel or fibrous tissue. ठीक है, अगर आप कोई भी किताब क्लासिफिकेशन के लिए फॉलो कर रहे हैं, तो ये कनेक्टिव टिश्यू के सेल से अराइज होता है. कनेक्टिव टिश्यू में if you think, if you are following the school of thought who says that this is hemangioma, तब इसका cell of origin is endothelium, but endothelial cell of origin is not going to convert into squamous cell carcinoma. Okay, so this is inflammatory condition. In some books, it is given as hemangioma, which is a benign tumor of blood vessels. The population affected is children, young adults, and pregnant women. And this tumor is also called pregnancy associated tumor. Why? Because during pregnancy there is a rapid growth, and it is very concerning for the patient, because they think that they had something which is initially small in size, and now as there is rapid growth, which we have also read in our chapter the neoplasia, कि क्या features होते हैं जो पता चलता है कि कोई benign condition convert हो गई malignancy में, तो it is rapid growth. तो यहाँ ये जो rapid growth है, it will give a pseudo impression to the patient that the tumor has increased, so it has become malignant. Usually this is slow growing, but as I said that it may be rapidly growing and have a concern for the patient. Histology पे अगर मैं इसको देखूंगी, पहले इसकी gross देखते हैं, फिर उसके बाद I'll again come back to this slide. Okay, This is the clinical picture. So how this clinical picture is different from that of the fibroma? Now, if I have to describe this lesion, how would I describe? Like if you are not a histopathologist, but if you are a person sitting in the clinic and somebody asks you to describe the lesion, I'll describe it. This is oral cavity, this is the pink mucosa, and then there is an abnormality over here. Why there is abnormality over here? Because this is bright red in color. If you compare it with the surrounding mucosa, what you can appreciate, it is light pink in color. Okay, I again emphasize it is light pink in color. So something abnormal is very evident. So body में अगर किसी जगह पे बहुत सारा red color है, so I don't know how to interact with you, but if I would have next time I try to, then I must be asking. Body में बहुत सारा red color है, body में बहुत सारा red color किस जगह पे होता है? Blood vessels में होता है. अगर कोई blood vessels में होता है, या अगर वो blood trauma की वजह से ooze out हो जाता है extracellular extravascular spaces में, तब भी it will give a red color appearance. ठीक है, तो कैसी appearance है? Red color appearance. ये red color appearance किस वजह से हो सकती है? या तो it is basically as a result of dense या very dense inflammation, or as a result of tumor which has endogenous in origin, or which is related to the blood vessels. Okay, so there is a nodule of approximately 1 into 1 inch, and it is raised above the surface. तो papule है, normal mucosa आपको pink नजर आ रही है. So if I again go back to the previous slide, अगर मैं इसको माइक्रोस्कोप में देखूंगी तो मुझे कैसा नजर आएगा? ऑर्गेनाइजिंग ग्रेनुलेशन टिश्यू की तरह. We have done chapter of inflammation, and in that chapter of inflammation, what are the acute signs of inflammation? The acute signs of inflammation होते हैं उस एरिया में congestion हो जाती है क्योंकि वहाँ पे vascular proliferation होती है. So going back to those basic signs of inflammation, which is one of the chapters of general pathology. कि कहाँ inflammation होगी? पहला क्या होगा? Inflammatory cells होंगे, and then what is there? There is proliferation of endothelial cells. ठीक है, अगर वो proliferation of endothelial cells बना के उन्होंने ट्यूमर बना लिया तो उसको हम lymphoma कहते हैं, और अगर वो सिर्फ inflammatory process है तो उसको हम granulation tissue कहते हैं. तो मैं अगर माइक्रोस्कोप में देखूंगी कि what is the microscopy? So on microscopy there is organizing granulation tissue. और organizing granulation tissue क्या होगा? These are the blood vessels of various sizes. Okay, so अब अगर किसी को पार्शियल ग्रेनुलोमा है, this is, as I said, this is a pretty common condition. आपके पास आता है, आप कहते हैं तो आपकी the person is pregnant and there is increase in size and the clinically it appears red in color. You say, okay, this is most likely the pseudotumor type of the condition which has increased in size because of the pregnancy. But what is the concern of the patient? अगर किसी को lesion है तो वो सबसे पहले आपसे क्या पूछते हैं? कहते हैं इसका क्या होगा? क्या ये अगर मैं इसको ना निकलाऊं तो क्या ये malignant हो जाएगा या ये खुद ब खुद ठीक हो जाएगा? तो what is important is that it will regress by itself. ये पेशेंट के लिए ये चीज बहुत इंपॉर्टेंट होती है कि अगर उसको कोई डिजीज है तो क्या वो डिजीज क्रॉनिक में कन्वर्ट हो जाएगी, क्या वो डिजीज रिग्रेस हो जाएगी, और देयर इज अ पर्टिकुलर ग्रुप ऑफ द मेडिसिन व्हिच दे हैव टू टेक फॉर देयर रेस्ट ऑफ लाइफ. ठीक है, तो यहाँ पे उसका फेट क्या है कि यूजुअली ये रिग्रेस हो जाता है, बट इन वेरी फ्यू केसेस ये मैच्योर होता है एंड इट कन्वर्ट्स इनटू आइदर डेंस फाइब्रस टिश्यू or into another type of the inflammatory or pseudotumor condition which is called peripheral ossifying fibroma, and the treatment is complete excision. I'm going to repeat the points of pyogenic granuloma. As I told you that the pyogenic granuloma, the history of the pyogenic granuloma was given, and the questions which were there, which I have checked, was what is the what is the possible cell of origin, and then with the population affected, histology, and finally the fate. Okay, so quickly I'll review, again repeat the points. The reason being that out of all those inflammatory or pseudoreactive conditions, the pyogenic granuloma is the most common. And this is you need to know the exact fate and related. So this is inflammatory condition. As I said in some books, it's given under the condition of meningioma, and meningioma is again benign vascular tumor. Population affected are children, young adults, and pregnant patients. Even in pregnant patients, it is written as a pregnancy tumor. Slow growth hoti hai usually, but it can be rapid, especially in pregnant patients. Then, if I do the histopathology or microscopic examination of the same, what I come to know is the granulation tissue. What granulation tissue is, which is composed of small blood vessels. So if it has become organized and it has acquired a type of pseudocapsule, we can take it, some school of thought take it as hemangioma. लेकिन अगर आपको histology लिखनी होगी तो histology का आप ये लिखेंगे कि organizing small blood vessels and with inflammatory cells. In majority of the cases, the patient does not need to worry about this condition because it is going to regress by itself. And in very few conditions, it is going to be converted into dense fibrous tissue and peripheral ossifying fibroma, which is not peripheral ossifying fibroma is something which is another pseudotumor type of thing, and this is not malignant, and the treatment is the complete excision of the tumor. I'm just telling you that again, इसका cell of origin क्या होता है? Endothelial cell of origin होगा या fibrous cell of origin होगा? जो फेट मैंने ऑस्ट्रीच चेक की थी उसमें जो फेट ज्यादा लिखा होगा the students have written that is going to convert into squamous cell carcinoma. Please always remember that a thing which is arising from the fibrous tissue or from the endothelial cell is cannot convert it into a malignant process of epithelial nature. ठीक है, अगर मैं आपसे पूछूं कि एक मेंजोमा है और उसका malignant counterpart क्या है? We have done this exercise when we were doing neoplasia कि अगर किसी का cell of origin endothelium है उसके benign region को meningioma कहते हैं और उसके malignant region को angiosarcoma कहते हैं. So although this does not convert into angiosarcoma, I'm just giving you an example कि जिस cell of origin को बेसिक में इसीलिए एम्फसाइज करते हैं जब वो ट्रांसफॉर्म होता है तो अपने malignant काउंटरपार्ट में ट्रांसफर होता है. ऐसा नहीं होगा कि एक टिश्यू जो उसका mesenchymal origin है it will convert into something of squamous nature. Okay, this is again कि अगर आपको oral cavity में कोई चीज नजर आ रही है which is this cherry red in color, exophytic mass. So this is most likely pyogenic granuloma, and this is the figure which was given at the time of Austrian. So please either go through my lectures or go through the Robbins, at least the clinical and the gross and microscopic pictures which are given over there. Okay, peripheral ossifying fibroma is the reactive. We are running out of time. Peripheral ossifying fibroma is another type of the reactive condition. This is long-standing, as we said that it can arise either from the pyogenic granuloma or de novo. ठीक है, de novo कोई भी चीज क्या arise होती है कि वो शुरू से ही सेल जो इसकी जो जेनेटिक्स थी वो ट्रांसफॉर्म हो गई थी टू डेवलप इनटू पेरिफेरल ossifying fibroma, और एक सेल है जो pyogenic granuloma रहा बहुत टाइम तक and then it convert into peripheral ossifying fibroma. So this also develop in young females. ठीक है, ये सारे पेशेंट्स होते हैं जो oral cavity की lesions है. अच्छी बात ये कि usually ये regress by themselves. ठीक है, recurrences uncommon है, लेकिन ये usually जो patients affected होते हैं वो सारे young patients होते हैं. Surgical excision होती है, sometimes इसकी periosteum तक remove करना पड़ता है. Then there is another condition which is peripheral giant cell granuloma, जिसमें अगेन फाइब्रस टिश्यू की प्रोलिफरेशन होती है, लेकिन यहाँ एक और कंपोनेंट क्या हो जाता है, these are the giant cells. I haven't put any morphology for this because these are rare. These are not going to be asked, but at least what is expected is that you should be able to name the various pseudo-inflammatory or pseudotumor lesions of the oral cavity, which we have started from irritation fibroma. Number 2 is a pyogenic granuloma. Number 3 is a peripheral ossifying fibroma, and the last one is the peripheral giant cell granuloma. ठीक है, अगेन इसमें फाइब्रस टिश्यू होगा, लेकिन यहाँ क्या चीज ऐड हो गई है, giant cell. जब हम बॉडी में giant cell कहते हैं तो giant cell का क्या मतलब होता है कि उस that cell has multiple nuclei. ठीक है, अभी हमने किसी कोई भी सेल जिसमें बहुत सारे न्यूक्लियाई होते हैं उसको giant cell कहते हैं. ग्रेनुलोमेटस इन्फ्लेमेशन में जो जाइंट सेल्स होते हैं इनके भी बहुत सारे न्यूक्लिया होते हैं, दोज आर आल्सो कॉल्ड जाइंट सेल्स। ट्यूमर बहुत अगली सेल्स होते हैं, दोज आल्सो हैव मल्टीपल न्यूक्लिया, सो दैट इज आल्सो कॉल्ड giant cell. So कोई भी सेल जिसकी बहुत सारे न्यूक्लिया होंगे, that cell is called giant cell. Again, this is reactive condition and can be easily excised. So basically, there are 4 different types of pseudo-inflammatory lesions of the oral cavity. Again, pyogenic adenoma is most important. Please go through the details. Okay, aphthous ulcers. The aphthous ulcers is something that I am sure that at least 50-60% of you have come across this condition by yourself or by one of the persons around you. These are extremely common. And superficial ulceration of the oral mucosa, and it has affected it almost 40%. That is why I said that one of you or one of your persons in your surrounding must have experienced this. So this is simply extremely common condition, but extremely painful, recurrent. ठीक है, जिनको एप्थस अल्सर्स होते हैं उनको ये प्रॉब्लम क्या होती है, ये अल्सर्स उनको बार-बार होते हैं and tend to be prevalent within certain families. तो इस स्लाइड से हमने क्या एक्सपेक्ट किया कि दिस इज एक्सट्रीमली कॉमन, extremely painful, recurrent, and there are some families which have it. And what is good about it, they usually by themselves go in 7 to 10 days. सिंगल होंगे, मल्टीपल है, शेलो और हाइपरीमिक अल्सरेशन होते हैं। इसके हम अभी फोटोग्राफ देखते हैं। Covered by thin exuded rim of the narrow zone, inflammatory infiltrate largely mononuclear but secondary bacterial infections can occur. As I said, it resolves in 7 to 10 days. We look at the clinical picture and then again come back to this slide. This is aphthous ulcer. Again, if I have to describe this, this is oral cavity. I can identify teeth over here. This is normal pink mucosa of the oral cavity, and then there is something which is sitting over here. Why it is different from the surrounding? This is a deeper ulcer. Ulcer हम कब कहते हैं कि किसी भी एरिया में ulcer, either it is in the gastrointestinal, either it is in stomach or it is in the oral cavity. Ulcer क्या होता है, जहाँ पे normal epithelium डिस्ट्रक्ट हो जाती है। ठीक है, you can imagine that epithelium हम आपको कराते हैं कैसे, epithelium side by side होती है, लेकिन जब epithelium डिस्ट्रक्ट हो जाती है, then we call that thing ulcer. ये एक ulcerated area. I am sure that you are not able to appreciate ulcer from here, but what you can able to appreciate is if I surround it like this, what you can see that there is a rim of hyperemia. हाइपरइमिया क्या होता है, किसी एरिया की ब्लड सप्लाई ज्यादा हो गई। जब किसी एरिया की ब्लड सप्लाई ज्यादा हो जाती है तो दैट एरिया इज सराउंडेड बाय रेड थिंग। ठीक है, तो ये जो रेड थिंग से सराउंडेड है, दिस इज अल्सर एंड इट इज कॉल्ड एप्थस अल्सर, क्योंकि ये वाला एरिया इसका शेलो होगा और अगर आप बुक खोल के देखेंगे तो वहां पे इसको आपको हल्की सी आप येलोइश अपीयरेंस आइडेंटिफाई कर सकते हैं। एंड दिस इज an area which is surrounded by the red line. So aphthous ulcer, single erythematous yellow surrounded by yellow fibrinofullid membrane. Again coming back here, ये अल्सर्स जो सिंगल हो सकते हैं, मल्टीपल होते हैं, हाइपरइमिक अल्सरेशंस होती है। इन्फ्लेमेटरी इन्फिल्ट्रेट इसमें यूजुअली मोनोन्यूक्लियर होता है। वो जब मोनोन्यूक्लियर कहते हैं तो इसमें मतलब होता है लिम्फोसाइट्स, बिकॉज बहुत सारी जगह ये कि जो इम्यून मीडिएटेड डिसऑर्डर्स होते हैं, उन इम्यून मीडिएटेड डिसऑर्डर्स में ये उन इम्यून मीडिएटेड डिसऑर्डर्स में होते हैं तो बेसिकली ल्यूकोसाइट्स होते हैं, लेकिन अगर इसके ऊपर सुपरइम्पोज बैक्टीरियल इन्फेक्शन हो जाता है, infection हो जाती है तो यहाँ न्यूट्रोफिल्स आ जाती हैं। एंड समटाइम्स some people who have the resistant disease and they does not respond, they need to take antibiotics, otherwise the lesions will go away by themselves in 7 to 10 days or even sometimes in a shorter time. Now glossitis, ठीक है, oral cavity क्यों important है, क्योंकि oral cavity is a place where you can identify the deficiency of different vitamins as well. Okay, beefy red tongue आपके पास होगी, deficiencies of different vitamin B12 deficiencies में pernicious anemia हो सकता है। ठीक है, राइबोफ्लेविन, नायसिन और पायरोक्सिन सब लेने की deficiencies होती हैं, तो they will present as beefy red tongue। उसके बाद स्टू या iron deficiency anemia होगा, ये आप मुझे देख के बताएंगे। प्लमर-विंसेंट syndrome next time I'll check how we can communicate what is Plummer-Vinson syndrome. So again, oral cavity is a site of Plummer-Vinson syndrome. So one assignment is that you have to tell me what is Plummer-Vinson syndrome and what is its relation with the oral cavity. Vitamin C की deficiency होगी, gum bleeding होगी, again the manifestation with the is the oral cavity. Okay. two other topics. Now 15 minutes are left. So the two important topics, one is the herpes simplex and other is the candidiasis. Herpes simplex, this is a viral infection caused by two types of the viruses, herpes simplex virus 1 and herpes simplex virus 2. Virus 1 usually affect the oral cavity and this the 2 usually affect the genital tract, but it can affect the oral cavity as well. What is important to uh, keep in mind about the herpes simplex? कि herpes simplex अगर किसी को एक दफा हो गया, then that person will carry, like मुझे एक दफा herpes simplex हो गया, then I'll carry it for the rest of life with me. Although in majority of the patients it will remain in dormant condition. ठीक है, herpes के बारे में दो चीजें याद रखनी है. एक तो herpes simplex वायरस 1 मोस्ट कॉमन होता है, ये ओरल कैविटी में इन्वॉल्व करता है. एक दफा किसी को herpes simplex हो गया, then that person has herpes simplex. It will remain in the dormant form in large majority of the cases, but sometimes we'll come to know what are the conditions in which the virus will activate and again manifest the disease. And second, what is important to remember is this is herpes simplex is highly contagious disease. ठीक है, तो क्या चीज हमें याद रखनी है? टाइप 1 है, herpes simplex oral cavity को अफेक्ट करता है. Once a person has herpes simplex, it will remain there for life. In the large majority of the cases, dormant conditions, and then this is a highly contagious disease. Contagious disease क्या होती है? जिसको बहुत आसान होता है, जैसे आजकल कोरोना वायरस है कि we can easily transmit it to others, although this is not bad as corona is. So primary herpes simplex virus कौन सा एज ग्रुप अफेक्ट होता है? चिल्ड्रन जो 2 to 4 years के होते हैं, ऑफन एसिम्प्टोमेटिक, नॉट कॉज सिग्निफिकेंट मॉर्बिडिटी, लेकिन in 10 to 20% of the patients it can cause condition called acute herpetic gingival-stomatitis. ठीक है, acute का क्या मतलब हुआ? जो चीज फॉरन हो रही है. herpetic का मतलब है herpes induced. gingival-stomatitis का मतलब है कि जिंजाइवा को भी अफेक्ट कर रहा है और ओरल कैविटी को भी अफेक्ट कर रहा है. देयर इज अब्रप्ट ऑनसेट ऑफ वेसिकल्स. ठीक है, तो पहले हमने क्या देखा, जो सूडो इन्फ्लेमेटरी कंडीशंस थी वो कैसे प्रोड्यूस करेंगी एज एक्सोफिटिक मासेस. अब जब हम वेसिकल्स की वर्ड टर्म यूज करते हैं, अगर मुझे किसी रीजन को डिस्क्राइब करना है एज वेसिकल, तो व्हाट इट इज, जिसको अगर आप कोई लेमन कहेगा कि मुझे छाला निकला हुआ है जो कि पानी से भरा हुआ है. ठीक है, सो दैट कंडीशन इज कॉल्ड वेसिकल, दैट इज a raised area which is filled with fluid. Okay, so clinical manifestation herpes की क्या होती है? एज वेसिकल्स. जब वो वेसिकल है, एक रेज्ड एरिया, उसमें आप पानी भरे जा रहे हैं, तो अल्टीमेटली क्या होगा? इट्स गोइंग टू बर्स्ट, एंड वंस इट्स गोइंग टू बर्स्ट, the epithelium will lose its connection and it will ulcerate. ठीक है, मैंने आपको अल्सरेशन की डेफिनेशन बताई कि अल्सरेशन क्या होती है. अल्सरेशन होती है जो नॉर्मल एपिथेलियम की डिस्ट्रक्शन हो जाती है. तो ये वेसिकल की तरह यानी छाले की तरह प्रेजेंट करते हैं. It's filled with fluid, it keeps on increasing in size. Once it keeps on increasing in size, there is destruction and it will lead to ulceration throughout the oral cavity, especially in gingiva. So in only 10 to 20% of the cases it can cause lymphadenopathy. lymphadenopathy क्या होती है कि आपकी जिसको कहती है, जिसको आपको लेमन आएगा कि मुझे गिल्टियां बन गई है. lymph nodes have been enlarged, fever, anorexia and irritability. lymph nodes body में कब significant होती है? when they are more than 1 centimeter in size. Again, clinical manifestation क्या होती है? vesicles range from lesion of few millimeters to large bully. ठीक है, vesicle की term clinically use होती है जब when there is a fluid filled thing which is small in size, but when it gets bigger and bigger, so then we use a term which is called bully. It is the plural of bulla. First filled with a clear serous fluid but often ruptured, leave extremely painful red and shallow ulcers. ठीक है, तो अगर मुझे एक फ्लो चार्ट बनाना हो कि कैसे बनेगा, तो पहले वेसिकल होगा, वेसिकल रप्चर होगा तो अल्सर हो जाएगी, एपिथेलियम डिस्टर्ब हो जाएगी. अगर मैं माइक्रोस्कोप एग्जामिनेशन करूंगी उस अल्सर का, तो व्हाट आई कम टू नो, देयर इंटरसेलुलर एडिमा. ठीक है, एडिमा कब होगा? अगेन इन्फ्लेमेशन के साइंस क्या होते हैं? इन्फ्लेमेशन के साइन होते हैं कि उस एरिया में ब्लड सप्लाई इंक्रीज होती है, तो एक्सल्सेटेड फ्लूइड होता है जिसको हम एडिमा कहते हैं. यहाँ भी बेसिकली इन्फ्लेमेशन हो रही है जिसकी वजह से इंटरसेलुलर और इंट्रासेलुलर एडिमा. दोनों टर्म्स में क्या मतलब, क्या फर्क है? एक का मतलब है कि सेल के अंदर फ्लूइड एक्यूमुलेट हो रहा है, दूसरे का मतलब है बिटवीन द सेल्स. इंट्रासेलुलर मींस inside the cell and intercellular means between the cells. ये terms जो basic pathology की terms हैं, they will remain the same. ठीक है, इंट्रा का मतलब होता है उसी चीज के अंदर और इंटर का मतलब होता है दो चीजों के बीच में. तो here we are talking about the cells, intercellular inside the cell and intercellular is between the cells, yielding flaps that may become transformed into macroscopic vesicles. Individual epidermal cells in the margins of vesicle or lying free within the फ्लूइड. ठीक है, माइक्रोस्कोप में देखेंगे तो हमें इसमें फ्लूइड मिलेगा. जो चीज आपने याद रखनी है एंड व्हिच कैन बी आस्क्ड इन बिकॉज दिस इज वेरी कैरेक्टरिस्टिक ऑफ दिस पैथोलॉजी. जो चीज आपसे पूछी जा सकती है वो ये कि अगर आपको देखिए मॉर्फोलॉजी कोई आपसे एक्सपेक्ट नहीं करता कि आपको मॉर्फोलॉजी बिल्कुल एग्जैक्टली पता होगी, लेकिन जहाँ चीजें बहुत कैरेक्टरिस्टिक हैं दोस कैन बी आस्क्ड. लाइक इसमें क्या होती है, इंट्रान्यूक्लियर इन्फ्यूजन होती है, सेवरल सेल्स होते हैं व्हिच फ्यूज टू फॉर्म जायंट सेल्स, इनको मल्टीन्यूक्लिएट polycreons कहते हैं, and these are diagnostic of herpes. How to diagnose herpes? किसी को herpes हुआ आपको कैसे diagnose करते हैं? It is with the help of this T-Zang test. T-Zang test लेने का तरीका ये है कि जो वेजिकल होता है उसमें से फ्लूइड लेके उसकी स्लाइड बना के देखते हैं. Here we can appreciate these multinucleated cells. ठीक है, तो अगर आप आपसे पूछूं कि T-Zang test is diagnostic of which pathology? It is herpes. नहीं, तो पैथोलॉजी के जो मॉर्फोलॉजी के पार्ट में आपको ये एडिमा वगैरह बहुत सारा नहीं भी याद होता तो देयर इज नो प्रॉब्लम. बट कि क्या चीज याद होनी चाहिए, ये चीज याद होनी चाहिए कि वेजिकल है, बुला बनते हैं, अल्सर होता है और ये इंट्रान्यूक्लियर वायरल इन्फ्यूजन्स होती हैं और मल्टीन्यूक्लिएटेड सेल्स होते हैं. एंड डायग्नोस्टिक ऑफ herpes इज T-Zang. ठीक है, सो दीज आर few tough pills you need to solve. अच्छा, herpes में लोकेशन याद रखिए. ठीक है, जो भी आपकी पैथोलॉजी में बहुत सारी चीजें उसकी डेमोग्राफिक्स से यूज करती है. herpes यूजुअली इफेक्ट करता है लिप को, यू कैन सी लिप ये और फिर नेजल कैविटी के पास. ठीक है, सो बेसिकली दिस इज herpes. जैसे मैंने बताया कि अगर आपको अगर someone has once acquired the infection, it will remain there for the rest of the life. So and it will remain dormant in the ganglions यानी nerves में वो infection dormant form में रहता है. और large majority of the population it's not going to cause any harm, but in some patients after trauma, allergies, ultraviolet light, upper respiratory tract infection, pregnancy, menstruation, immunosuppression, the virus again activate and causes infection. सो ये इतनी सारी लिस्ट देख के क्या चीज समझ में आती है, इतनी सारी लिस्ट देख के हमें ये चीज समझ में आती है कि हमें ये एग्जैक्टली नहीं पता कि herpes अगर किसी को एक दफा हो गया है तो ये कब एक्टिवेट होगा, लेकिन ये प्रॉबल एटियोलॉजीज हैं जिनके बाद ये एक्टिवेट होता है. Thrush or candidiasis. Okay, so as I told you earlier that out of this lecture, three are the things which are most common and which need to be emphasized. One is herpes, paragenic granuloma, and third is the oral candidiasis or thrush. This is the most common fungal infection from which human suffers. I'm sure that most of you know that the candida is a part of normal commensal in the oral cavity. 50% लोगों की oral cavities में कैंडिडा ऑलरेडी होता है. ठीक है, और कैंडिडा ओरल कैविटी के अलावा और कहाँ पे होता है, यूरिनरी ट्रैक्ट में होता है, फिर म्यूकस मेम्ब्रेन्स ऑफ ईयर में हो सकता है, और अगर हम गैस्ट्रोइंटेस्टाइनल ट्रैक्ट में we move downward, so it is also present in the esophagus. लेकिन it will remain silent. commensal है, जो हम sugars लेते हैं, जो हम कार्बोहाइड्रेट लेते हैं, ये कुछ पार्ट इसका is taken by that as food, otherwise it does not harm humans. 3 factors हैं जो ये करते हैं कि कब कैंडिडा इज गोइंग टू बी पैथोजेनिक. ठीक है, नॉर्मली ये क्या है, कमेंसल है. कमेंसल क्या होते हैं, वो ऑर्गेनिजम्स जो हमारी बॉडी में सर्वाइव कर रहे हैं बगैर हमें कोई, जैसे हमारी कोलन है उसमें बहुत सारे माइक्रो ऑर्गेनिजम्स हैं. ठीक है, बहुत सारे बैक्टीरिया ऑलरेडी हो क्या है, वो वहाँ के नॉर्मल कमेंसल्स हैं, वो कुछ आपको नहीं कह रहे. इसी तरह ओरल कैविटी में Candida is present as normal commensal, but it can become pathogenic. Pathogenic का मतलब क्या होता है कि वो organism which start causing the disease. So immune status of the patient. Once the patient is immunocompromised, he has developed cancer, he has taken broad spectrum antibiotics, जैसे उसके नॉर्मल oral flora को चेंज किया तो he can develop candidiasis, and then there are particular strains called candida albicans which can cause and then composition of individual oral flora. Three major clinical forms होती हैं. Out of this, the most common is pseudomembranous or thrush, other one is erythematous, and the third one is hyperplastic. अब जो हमने initially picture देखी थी उसमें you could have appreciated कि एक erythematous थी जिसमें थोड़ा सा red color था और फिर white area था. तो थ्रश और सूडो मेम्ब्रेन. ठीक है, सूडो का क्या मतलब होता है? फॉल्स, यानी जो आपको मेम्ब्रेन की तरह लग रही है लेकिन जब एक्चुअली आपको किसी चीज से उसको स्क्रैप करते हैं तो वो स्क्रैप हो जाती है. बेसिकली थ्रश को हम ल्यूकोप्लेकिया व्हिच इज अ प्री मैलिग्नेंट कंडीशन से डिफरेंशिएट ऐसे करते हैं. जब थ्रश होता है, जब कैंडिडियासिस होता है, आप उसको स्क्रैप ऑफ करते हैं, वो स्क्रैप ऑफ हो जाता है. इसीलिए हम उसको क्या कहते हैं? सूडो मेम्ब्रेन. जो हमें मेम्ब्रेन लग नहीं होती नहीं है लेकिन एक्चुअली वो हमें लगती है, इसीलिए हम उसको हल्का सा स्क्रैप करते हैं, वहां से हट जाती है. और मैंने बताया कि इसके डिफरेंशियल डायग्नोसिस में हमारे यहाँ ये गुटखा पान की वजह से स्क्लेरोसिस कार्सिनोमा इज वेरी कॉमन एंड ल्यूकोप्लेकिया इज वन ऑफ द प्रीकैंसरस लीजन्स. So the easy way to differentiate is of course after symptoms all that a वो scrape off हो जाता है. Superficial curly grey to white inflammatory membrane होती है of flatted organisms enmeshed in a fibro suppurative exudate. It can be readily scraped off to reveal an underlying erythematous inflammatory base. So then caries, this is the disease of the teeth, which usually develop in young patients when the sugars we eat are broken down into acidic products and which actually causes the demineralization of the tooth structures. Then gingivitis, inflammation in gingiva due to the lack of the proper oral hygiene, and the lesion is caused a dental plaque and calculus. ठीक है, dental plaque क्या होता है कि वहाँ पे एक मेम्ब्रेन बन जाती है जिसमें बैक्टीरिया होते हैं, डीजेनरेटेड प्रोडक्ट्स होते हैं, जो कैल्शियम जाती है जिसको हम कैल्कुलस कहते हैं. So then what is periodontitis? Is the inflammation of the supporting structure of the teeth leading to loosening and eventual loss of teeth. पैथोजेनेसिस में इसके जो है ये होता है कि जब इवन तो लॉस हो सकता है एंड इट कैन बी इंटरस्टिशियल डिजीजेस लाइक एड्स. These are the conditions which are related to maxillary are relatively uncommon and doesn't need to be done in detail. So that's all for today's lecture. So basically quickly, this is herpes. क्यों herpes है? Because इसकी location है. You can see that they are slightly